Thank you for being here, and it's a real honor to be here and share with you something that I've learned over the last few years, a medical model that restores optimal function, utilizing hormones, nutrients, detoxification, mind and body balancing. Carl Sagan said that a good scientist can entertain mutually contradictory ideas, and that science requires a strange mating of two contradictory tendencies, a willingness to consider even the most bizarre ideas, and at the same time a harsh skepticism requiring hard evidence to back up every claim. And most of us, when we sit in this audience where I have sat for many years also, are exactly in this position where we're interested in considering the things we don't know and requiring hard evidence to support them. So as we go through and look for ways to have an optimal living and optimal health over the 40 to 60 years extra that we're living, and we're looking for the science of staying young and how to eliminate and squelch the inflammation that's the source of most diseases, I want to bring to you a model that is based not upon references like this or this native Brazilian medicine woman who I actually worked with in Brazil for a little while, but it is based upon the references. I'll be going reasonably quickly because what I want to do is show you what I've learned in terms of what the model looks like, and then I actually want to go through a couple of presentations and try to show how to apply it. So I'll be flying through it a little bit, but understand that it is heavily literature based. I start off, I'm an OBGYN. It was pretty easy for me to learn how to use bioidentical hormones after doing quite a bit of reading and research. But what I found is that without paying attention to the nutrients that activate it, the toxicities that come in the way and block production and function of hormones and nutrients, balancing the mind and balancing the body, that is required to actually address just about any condition. You take any condition you can name and you'll find that you're able to at least have some kind of a base to start with. It doesn't matter whether you've treated that illness or not, because I put forth to you that it's imbalances in these 5 areas, and they're very basic, that more or less are responsible for the different kinds of illnesses that we manifest. Why should we look at the hormones? With each passing year, our organs produce less hormones, notably from age 25 onwards, and all of the hormones here, all the estrogens, progesterone, testosterone, the metabolic, thyroid, insulin, cortisol, DHEA, melatonin, pregnenolone. Progesterone is the first to go. Patient coming in mid-30s, lighter sleep, anxiety, panic attacks. I've been to the emergency room several times. It's the #1 reason for a Prozac prescription. Mood swings, irritability, breast cysts, ovarian cysts, fibroids, and heavier bleeding. Progesterone deficiency is probably one of the #1 underlying reasons for women in the early 40s to end up with a hysterectomy. Worse PMS, mid-abdominal weight gain, low sex drive, even hot flashes can be from progesterone. And it is the #1 cause of bone loss in the mid-30s, simply because progesterone is so important for osteoblastic activity and bone building. So obviously women don't acquire a Xanax and Prozac deficiency when they reach age 38 or whatever age. It is a progesterone deficiency. The receptors for these hormones are present on every single cell of the body. Estrogen, progesterone, testosterone, and everything else. So it is no wonder that hormone deficiencies contribute to not only a host of symptoms that you see on the left side of your screen, but also a host of diseases, because as the hormones stop maintaining or slow down their maintenance of the organ systems start to decline. And therefore, for example, those of you who know that the base standard is in a woman with a hysterectomy not necessarily to use progesterone, but what we know is because all of these other organs have progesterone receptors, even a woman with a hysterectomy should be treated with progesterone. If you look at the medical standard and we ask ourselves, well, it's such a maze, I don't know what to do, it's so confusing, but if you look, the medical standard is actually to restore what is missing with what is missing. So this is not far from the medical standard. Obviously, I'm saying that we should be with the hormones on board, but I want to arm you with a few pieces of information that have helped me over the years address colleagues and patients that are concerned about the findings that have been found in WHI study and other hormonal studies. I don't have time to present you the data on this, but there is a clinical review article which was written and published in the Science, in a journal, and it actually reappeared in the Science News for this A4M in winter, just so you have, because it has about 130 references in it. But at this point, we're very clear that there's 4 reasons why they had increased risk in the WHI study. One was pre-existing disease. The women were average age 63, memory study average age 71. They used the oral route, and I'll tell you a little bit about that in a moment. The wrong ratios of estrone and synthetic progesterone, which is progestin. And in fact, NAM's July 2008 position statement, which is the first time this organization actually issued a statement in 2004, again 2005, again 2006, and it kept changing until 2008, says recent data support the initiation of hormonal therapy around the time of menopause. And they're not even talking about, they're talking about the hormones that were used in the WHI study. But let me go back. I didn't realize I don't have these slides that I was going to look at, but the oral route, the cardiology literature now has about 3 dozen and growing studies that have been published comparing in a randomized controlled fashion the difference between oral estrogens and transdermal estrogens. And every single one has come to the conclusion that the oral estrogens increased the triglycerides by 27%, increased the clot risk by 3-fold, increased the risk of heart attack and stroke because they increase the fibrinogen pathways and all the clotting mechanisms in the liver, simply because they're passing through the liver and stimulating all of the liver clotting factors. So we know in those same studies that transdermal estrogens are delivered to the body in the same way that the ovary delivers them, because they go through the inferior vena cava and go out through the rest of the body before hitting the liver first. And they have been shown to decrease clotting mechanisms, decrease blood pressure, basically give you the protection that was there when the hormones were balanced to begin with.